For today's conversation, the chat for participants has been disabled, but you are able to place questions in the Q&A box. We will have a time at the end of today's discussion for open Q&A, which I'll curate from the list that's generated. But I'll also be monitoring the Q&A throughout today's conversation so that you all will have an opportunity to integrate some of the questions. We also took questions from registrants prior to the webinar and hope to cover some of your questions throughout today's discussion. So for over 50 years, the Charlottesville Area Community Foundation has sought to be an engine for positive change in our region, serving the Charlottesville area and providing philanthropic resources to move the needle on some of our most pressing problems. Today, we have several of our community partners who we have been working with for over the past year to bring about a change in our with the issue of chronic homelessness in our community. So first, I'd like to introduce my fellow panelists today. First, we have Sunshine Mathon from the Piedmont Housing Alliance, Executive Director of the Piedmont Housing Alliance. Hey, Sunshine. Julie Anderson, Director of Real Estate Development at Virginia Supportive Housing. Anthony Haro, Executive Director of the Thomas Jefferson Area Coalition for the Homeless. And Jayson Whitehead, Executive Director of PACHM, People and Congregations Engaged in Ministry. And in a few minutes, we'll have an opportunity to speak to hear from each of our panelists. But first, I'd like to give you a brief overview of what it is that we've been up to and what this project is all about. So I'm going to take a moment to share my screen here. Great. So as you all have heard, this is the first Investing for Local Impact grant from the foundation, where we invested $4.25 million of foundation resources to support the acquisition of a property at Premier Circle. As I mentioned, our partners in this endeavor were the Piedmont Housing Alliance, a Charlottesville area nonprofit organization dedicated to improving financial outcomes for individuals and families by offering innovative, affordable housing solutions. The Thomas Jefferson Area Coalition of the Homeless, which is a broad-based coalition of organizations working to make homelessness disappear in our community. And Virginia Supportive Housing, a longstanding partner in the community, as well as a statewide nonprofit dedicated to ending homelessness by providing permanent supportive housing and supportive services. And then People and Congregations Engaged in Ministry, which is a grassroots organization local to Charlottesville that works with many local congregations and community groups to provide shelter for the homeless, as well as attending services to them. And so I want to back this up by saying that this project began during the height of the pandemic, when it became very clear to the partners that are with us today that housing individuals in group shelter was not conducive to public health and safety during the course of a pandemic. And I want to give kudos to the number of organizations within the homelessness ecosystem that really rallied to ensure that our most vulnerable community members were sheltered in local hotels in order to prevent spread within that community and also the broader community. That is something that has kept our entire region safe and underscores the intersecting relation and conjoined relationship between housing and public health is something that we cannot, you can't have one without the other. And so one of the things that became very clear was that this was a very expensive solution to a problem that didn't provide a long-term solution. And so it really allowed an opportunity for our partners to think really creatively about how we might solve the current issues, but also looking for the long-term solution. As background, I think some of the statistics and information that's been helpful for me to kind of wrap my head around this work is that it typically costs approximately $31,000 annually for our community to support a chronically homeless person. However, it only actually costs $10,000 annually to provide that same individual with permanent supportive housing. In addition, over 2,000 households in our urban core are severely cost burdened in that they are paying over 50% of their income towards housing costs. Some of the things that we've known is that providing permanent supportive housing and affordable housing works. In 2012, the Crossings housing development, ushered in through work by Virginia Supportive Housing and through funding from the foundation, cut our number of chronically homeless population nearly in half. And those numbers have plateaued over time, that and makes it such that this development is quite timely for our community and in many ways overdue. So not only does permanent supportive housing and affordable housing reduce chronic homelessness, it improves the quality of life of individuals, but also has significant cost savings and impact for our community. And our partners are going to talk more about that later. So this project involved the foundation providing some of the funding for acquisition of a property called the Red Carpet Inn on 29. It was a unique and rare collaborative opportunity to provide support during the global pandemic and to provide long-term access to affordable housing for our most vulnerable community members. The redevelopment will include permanent supportive housing for 80 units of permanent supportive housing, as well as 60 units of affordable housing, and will host emergency shelter in the interim as the site is being redeveloped. And this is the illustration for the final site plan, which we are really excited by and encouraged by. There's lots of green space and protection from the main road to the front of the property as well. I'm not going to go in depth in this timeline. After the presentation, we will follow up with individuals who are participating with a recording of the webinar, as well as more detailed information about the project. But it's important to note that this is a long-term redevelopment process, during which time emergency shelter and temporary shelter will be provided to folks as the project is being redeveloped. One question that we've heard consistently from folks in the community is about transportation and walkability. And we have created a map of walkable amenities that demonstrates the capacity for folks to be able to get the vast majority of their needs met within a half-mile radius of the property. Sunshine and other folks will talk about other ways that we've been looking at accessibility for the project as well. And then also please note that there is bus service within a 1/3 mile of the property that runs to major networks in the community, providing access to other amenities beyond the scope of what's within the immediate neighborhood. So thank you for listening to that brief project overview. And now I'm really excited to get into discussion with our partners about their good work in this project. So first, I'm going to ask each participant to share a little bit more about their role in the project, how it fits within their mission, and the needs of the community. You know, I want to hear a little bit about why this is so important right now and how is this exciting for you. And so we'll start with you, Sunshine.
I was about to say good morning, but it's not morning anymore. Good afternoon, everyone. Glad to be here, and thanks for taking the time to listen and participate in this. Many of you know Piedmont Housing Alliance is the largest nonprofit affordable housing provider in the region. While most of our work focuses on the traditional affordable rental housing spectrum. When Anthony and I first had a conversation about the possibility of looking for a motel to acquire and ultimately transition into long-term permanent supportive housing, but meet the immediate non-congregate housing needs, I threw my hat in the ring to support however we could support to that process. We wanted to be a participant. In my past work, previous to coming here in Charlottesville, I worked for an organization in Austin, Texas, that developed permanent supportive housing similar to what Virginia supportive housing here does here in the state of Virginia. So I had some past experience and understanding of how impactful that model was, and wanted to be in a position to support that as much as possible and bring our real estate expertise to the table. So from our perspective, it directly aligns with exactly what we're trying to do, which is to end homelessness, to provide everyone in the community as much as possible housing that they can afford, that's safe and comfortable and welcoming, and that they can feel pride in. And so that's the essence of the long-term vision.
Thank you, Sunshine, for that. Julie.
Hi, everyone. So I'm Julie Anderson. I'm the Director of Real Estate Development for Virginia Supportive Housing. I apologize, my husband's really loud in the other room. We're kind of limited on space here. But VSH's mission is to end homelessness. And so the best way we do that is by developing permanent supportive housing. So that will be the 80 units of permanent supportive housing on the site. There'll be studio apartments, full kitchens and baths, fully furnished. And I think what makes this project so exciting to me is that it will effectively end chronic homelessness in the region. Also, you mentioned the crossings at 4th and Preston, our other development in the area. This would allow for some economies of scale with that development, and also the support our staff need, to have other staff in the area to help support this difficult job.
Excellent. Thank you so much, Julie. Anthony.
Hey, I'm Anthony Haro. I'm the director for TJAC, and also just really honored to be here with these other amazing people, part of this partnership. And this fits in with our work for all the reasons that you just heard. This project both addresses the immediate needs for people to have safe housing and shelter. Still in the pandemic, I know we're working our way out of it, but still not out of it. And this opportunity provides us with an option for safe places for people to be in the interim, but also gets at the core issue, the underlying cause of homelessness, which is lack of housing. And the best way to do that, especially for chronically homeless folks, is through permanent supportive housing. And so that's why this is such a big deal, is it is able to address both those things. And as Julie said, this will get us right to the doorstep locally of reaching a functional end of chronic homelessness, which is qualified, which I can talk to you a bit more, but that is the national standard that we're all shooting for, frankly. And Charlottesville really has an opportunity with this project to get there and really change our homeless ecosystem in a really significant way. So just happy that these other partners were able to walk with each other through this process this past year, and we're still walking. So very grateful to be here. Thank you.
Thanks, Anthony. Jayson.
Hi there. I'm Jayson Whitehead with Pacham, and I'm excited to be here. Pre-pandemic, Pacham was a seasonal overnight shelter, but I would say, I think June 2020, we were presented with the option to be able to have a hotel, and that's been a really exciting venture to be a part of, because it's provided year-round, full-time availability places for our guests to live. And we've been supervising and staffing that since June 2020, and we'll be providing similar role over at this new project. And the new project is has the potential to really even be more significant, even just on the shelter level, because while it will start just at 50 units, it could end up even being 100 units. So we're talking about this incredible expansion and availability so that hopefully no individuals experiencing homelessness in the area will be out on the street. So we're very excited to be a part of this project, and look forward to answering any questions you might have.
Thank you, Jayson. So I have a couple of questions here for you all. Sunshine, you spoke earlier about your work in Austin. I'm wondering if you can expand on that a little bit and situate this project within the context of the statewide and national sort of landscape. Are there examples of this kind of work in other parts of the state or the country?
Thanks for that, Ebony. Yes and no. So the yes part is that there is a history of permanent supportive housing organizations acquiring old hotels to convert them to permanent supportive housing. And in fact, in my time in Austin, I've participated in 3 projects like that. But what makes this project specifically, I think, unique across the country, I have not heard of any other examples, is the multi-phase and multi-partner effort that's going on that addresses the immediate non-congregate emergency shelter needs while planning for a holistic vision of tiers of affordable housing on site, including permanent supportive housing and additional affordable housing beyond that. I'm honestly not aware of any other project that has done something similar, and certainly not in the state of Virginia. And in fact, I've heard anecdotally from colleagues across the state that they're paying close attention to how this process here on Premier Circle does its work, because they see it as a potential guiding star for similar work in their own communities.
Wonderful, thank you. I think that we can all say that, you know, this has been really a unique opportunity for us as well to participate in this sort of like phased planning and execution of this project. So moving from kind of the conceptual framework, I'm curious about sort of the longer term plans for the property. And so Sunshine, can you talk a little bit about some of the ways in which the redevelopment of the site will be an improvement on the current landscape? I think that and any innovations in terms of energy efficiency, green building, pedestrian accessibility, all of these things that you know, we think about affordable housing and it's just like we want to get folks homes, but there's some unique opportunities here as well. And I'm curious to hear about some of those.
Yeah, before I jump into that second part, it's a 2-part question, what I'm hearing there. The first part is around the kind of the shifting of the landscape. So, you know, obviously it's been the location of a red carpet inn for decades. And one of the things that we discovered as we were going through the due diligence of acquiring the motel, but has become even more relevant as we've acquired it and started doing the room inspections, is that it has been just barely limping by as a space. The condition of many of the rooms is very, very poor, to the point where they had previously shut down some of their existing units because they didn't want to invest in the money in maintaining them at all. So the reason I share all of that is because it's important to highlight the fact that we are going to take an existing poorly maintained property and actually transform it over the next 3 to 5 years into a thriving series of communities that support some of our most vulnerable residents and neighbors in the community. And it's going to be a phenomenal transformation. Honestly, I think it's going to be amazing. the majority of the space is going to be dedicated to supporting low-income households through housing, whether the permanent supportive housing model that VSH is going to do, that we're working with Julie, or some additional affordable housing in a more traditional sense that we are going to be doing at a later phase. But there's also going to be on the frontage along 29, there'll be some dedicated commercial space to develop over the long run, which is the kind of final phase. And while we don't know exactly what's going to go there yet, we still have a significant amount of time to figure that out. Our hope and goal is to try to strive for that commercial space to be somehow beneficial to the new residents who are going to be living on site. And then to address the second part of your question, Ebony, personally, and I know that my colleagues here on the call share this sentiment, I see a very strong alignment between housing justice and environmental justice. And so whenever we look at the development of a property, yes, of course, the fundamental core is around the provision of housing that people can afford. But far more than that, and in my opinion, equally important, is that one, that place is a place where people can feel pride in where they live, because it's beautiful, because it's well maintained, because it is a kind of space that people want to live in. Every project that we build from a new construction perspective is a community, ideally, that anyone in the community would feel comfortable and desire to live in. And then connected with that is whenever we're building new construction, which is the case here, we have the opportunity to go above and beyond around energy and water efficiency, healthy materials in the units and so forth. And recently, the state of Virginia joined the Regional Greenhouse Gas Initiative, which has actually unlocked a significant amount of funding to help facilitate deep dives into energy efficiency work across all new projects moving forward. So I know in our own project, we're going to be pursuing Passive House most likely, which is the kind of gold standard for energy efficiency. We'll likely pursue solar on there as well to help reduce energy costs even further. And those principles go hand in hand with providing the best possible housing that we can for the most vulnerable clients and residents in our community.
Wonderful. Thank you for that, Sunshine. I'm going to move on next to Julie Anderson from Virginia Supportive Housing. Julie, Sunshine hit on that. The goal is to create housing that anyone can take pride in. I'd love to hear you speak to, based on your experiences statewide and with the crossings here in Charlottesville, what are other ways that you've seen improvements in quality of life for folks in permanent supportive housing? And if you can elaborate on some of the cost savings and benefits to the wider community as well, that would be great.
Okay, sure. So, in terms of the quality of life, chronic homelessness is hard, homelessness is hard. So our residents usually, when they come to us, have a lot of health issues that need to be addressed, whether those are mental, physical, substance abuse related, or really all three. Our case managers are on site to help connect them with the services they need to address any of those issues. Our typical resident stays about 4.5 years, and that is kind of the amount of time it takes to really work through any of those issues. Although we do have residents that this is the level of support they find that they need for the rest of their life. You mentioned earlier the cost savings to the community, and it is about that $20,000 per resident. But really, I think that the biggest takeaway for PSH is that it ends homelessness and improves lives. Over 95% of our residents don't return to a state of homelessness. So just really driving home that point that permanent supportive housing works.
Thank you. There have been some questions about eligibility for permanent supportive housing. Can you talk about who your your common client profile might be, and who's eligible to live in those units?
Sure. So First, these are studio apartments, so we're focusing on single adults. Obviously, you know, they may have spouses or children somewhere in the community, but at the time they're experiencing homelessness, they are in a single state. We often prioritize chronic homelessness. That's the group we want to address first, followed by homeless individuals. And then we also typically have a few units in a building that are someone who's low income, earning less than 50% of the area median income would be eligible for. And that split, the kind of the homeless versus low income units, is really dependent on how many vouchers we're able to commit to the project, or if an individual has a voucher when they move in.
Thank you. There's a question in the chat that's related to eligibility. Do you earmark any of your rooms for individuals with any particular conditions beyond chronic homelessness? We have a question from the folks at the Bridge Line who are commenting on your housing in I think in the Richmond area for individuals with traumatic brain injuries. Can you speak to that a little bit?
Sure. Yeah. So the buildings that they're referencing are group home settings. And so this will be a more independent living building, but we do have units that are fully accessible for individuals with disabilities, and also hearing and sensory disabilities. So we will have a couple of units in the building for that.
Wonderful. Thank you for that, Julie. I'm going to move now to Anthony Haro. So we've heard a little bit about what the long-term projected plans are for permanent supportive housing and affordable housing. In the interim, the site is going to be used as a temporary shelter for folks. I want to talk about the sort of transitional process here. Could you talk a little bit about, you know, we saw earlier that there were several long-term motel guests who had been staying at the Red Carpet Inn. And I want to hear some of the outreach efforts to ensure their safe transition and how this project actually goes towards addressing some of the issues that you saw in that process.
Sure. Yeah. So I reached out to the previous owner, to inquire about people that were staying longer term. You know, we wanted to make sure that people weren't displaced to homelessness as a result of this project. And so we wanted to get in touch with those folks and make sure that they had plans. And if they didn't, we wanted to see how we could assist to ensure that they didn't fall into homelessness. And so, you know, we reached out to those households that the previous owner notified me about. Some of them had found housing, which was great. Some of them had already moved or had plans to move to different communities. But some didn't have plans and needed assistance. And so we worked with local hotel to get reservations for those households so they can move in into the hotel after the transfer of the property to PHA. And, you know, this project does absolutely address, you know, the need for affordable housing in our community, which was the underlying issue that led to people living longer term at a place like the Red Carpet. And so that's, you know, one of the things that's just so exciting is that this project addresses immediate needs for shelter, permanent supportive housing for chronically homeless folks, but also affordable housing, which our community also direly needs, which leads again to folks living longer term in motels and hotels. And so, you know, we were happy to be able to support these folks in their transition. And frankly, they're still, you know, having a difficult time finding units in the community, but we're going to work with them as much as we can to, you know, make sure that they're supported in the interim before they find their own places in the community. So,
thank you. So some of the questions that came in from folks who'd registered for the webinar are really about shelter operations. And so I have a few questions that maybe Anthony and you, Jayson, can field here. One of the main question that people keep asking is, when are you opening for business? So anyone who has the answer to that question and what you project there can be helpful.
Jayson, you want to go first?
Sure. The The plan right now is to move the folks that are currently staying at the La Quinta over to the new project on May 1st. And right now, there's kind of a tremendous amount of rehabilitation being done on the current units and the site to get that into place.
Yeah, and so we're going to be phasing, this is the first phase, is the about 50 households that are currently at La Quinta Suites, like Jayson mentioned. The second phase will be opening up additional rooms for, other folks in the community that need housing to move into. And we're sprinting towards getting those up and ready. I think it's difficult for us to give a really definitive timeline at this point about when those units probably can come online. But we're hoping to get up to 75 or 80, I would say by the end of the summer. But again, it's probably difficult for me to give a definitive timeline on when we will have all those rooms up and ready and we'll be, open for business in that sense.
I add one thing to that just quickly, which is just to say that the reason that the renovations that Jayson referred to, the reason those are necessary is because of the existing condition of the property right now that I had referenced previously. And in particular, we know that some of the folks who are going to be moving into these units are going to potentially be there for as long as 2 or 3 years in these non-congregate emergency shelter while the permanent supportive housing gets built. And so we need to make sure that those units that they're moving into are healthy and safe. And the existing condition right now is that the majority of the units have some form of mold on the walls, need to be repainted, the flooring needs to be replaced and or repaired. There's a lot of mechanical, i.e. HVAC, heating and cooling, and plumbing needs on site. It's actually relatively extensive. So we're trying to walk the very fine line between investing in appropriate renovations to make sure that those spaces are safe and healthy, while not over-investing in those, because we know that those buildings are going to be torn down in the next 3 to 5 years. So we don't want to, quote unquote, throw money away, but it's critically important that those units are healthy and safe for folks to move into for the next 2 to 3 years.
Yeah, thank you, Sunshine.
Thanks for that. Can you speak a little bit to eligibility, Jayson, and Anthony, for the shelter rooms?
Sure. So, I'll start, Jayson, if that's fine, but eligibility for shelter across our system of care is pretty basic, but it's, experiencing homelessness, which we define as someone who does not have a housed location to stay in. So, in the next, they would be on the streets essentially if it weren't for shelter over their heads, in a shelter program. So we focus on folks that have no housing options available to them. Living doubled up with friends or family on a longer term basis isn't the focus for folks moving into shelter. And that's primarily because of, we need to focus on people who don't have any shelter at all, but also because it's defined by HUD, frankly, for our eligibility for emergency shelter. So it is for folks who have literally no place to go, sleeping in their car, living outside, or living in other shelters in the community as well. That also counts. So you want to add anything to that?
And I would add that so far, the majority of folks that have been staying at the hotels have been tier 1 medically vulnerable, according to CDC guidelines.
Right,
and that was largely an effort to provide a safe place for folks that were particularly susceptible to COVID-19.
Right. That's a great point. Per this guidelines, we've focused on providing those hotel rooms for, folks with the conditions that the CDC laid out, elderly folks, folks with respiratory issues, other immunocompromised conditions. So that does make up a large part of the homeless population that we've been sheltering.
Thank you both for that. There was a comment in the Q&A that I think that you guys have answered, but I want to kind of highlight. There's a question about, why put any money into the red carpet renovation at all, and why not demolish and get going? And I think that this has been sort of asked and answered in some ways, but I think it's worthwhile laying that out really clearly for the community, and drawing the through line between what's happening in the current hotels, the sort of lack of capacity to extend that, as well as the health and safety conditions. So if you can reiterate that, please.
Can I jump in there in that 1 second?
Sure.
So I will say fundamentally, we absolutely are getting going. So the question about why not get going, that actually is what's happening. So Virginia Supportive Housing has in early March or mid-March applied for the primary funding mechanism, low-income housing tax credits, to facilitate their project development. But one of the things that is not well understood more broadly, and I understand because it's complex, but the development of new construction affordable housing is a lengthy process that requires oftentimes as much of a year pulling together the finance, or even longer sometimes, pulling together the financing to then get you to the point where you can start construction. And then once you start construction, then you have anywhere from maybe 18 months of construction time before you can open. So if you look at the picture from now to say 2.5, 3 years from now, when Virginia Supportive Housing's project opens, that's a 3-year gap where people would be otherwise having to be stayed in existing motels currently. And we see this opportunity to shift people over to the non-congregate shelter on site as significantly a cost-saving measure, because it's going to be far less expensive to keep them housed over that 3-year period than paying for traditional motel rooms and other motels. So it is absolutely a parallel track. And this is in many ways the best of both worlds in terms of how things are moving forward.
Thanks, Sunshine. I wouldn't add much to that. I think that was well said.
I agree. Thank you. And for the reminder that, yes, we are already, you guys are already out of the starting blocks there. So I appreciate that reminder too. So I have a couple of questions. One of those has been pretty consistent as well, I think, all throughout the process, from the public commenting as well as questions submitted by registrants. And I think this is one that each of you can answer for your respective roles in the project. But there's been a consistent desire to understand and ensure that there are supportive services for residents at each phase of this development. And by that, I mean supportive social services related to their holistic needs being met beyond their immediate shelter needs. So if each of you can speak to the kinds of case management that's available at each phase, and beginning with temporary shelter, moving to permanent supportive housing and the affordable housing development.
Sure, I can start off with that one. Number one is Pachem will be providing our own case management services, and that's intensive, housing-focused, client-centered case management. And we're actually going to be expanding our case management services, especially for just this project. And another way we're really looking to provide supportive services over at the site is once we're kind of able to get our feet on the ground and get online, is to resume external service provider visits. Some examples of that are the UVA Health Clinic that's actually been involved all throughout this pandemic over at the hotel, as well as in Pachem's congregate, limited congregate setting this past winter, mental health counseling. Some other examples even are we've had regular COVID testing, as well as vaccinations made available to our guests. And then we're hoping to even be able to, hopefully by the end of May, offer like a service provider visit, so that I would love to see as many supportive services as possible over there working with our guests. And I think one exciting thing about this project is that it's going to really provide an opportunity for supportive services to really get involved, because each guest will have their individual room. We hope they even have a private meeting space over there available for any kind of in-depth meetings. So from our end, as much as we can provide.
All right, so for the VSH, I'm sorry, Anthony, did you have something to add?
Just one more thing real quick for the shelter portion, the interim housing portion. Besides the supportive services for health, mental health, well-being, our big focus, like Jayson said, is housing focused. So, we want this to be a safe place for people to feel grounded in, but we also want for people to be able to move out into the community, because it is time limited, even though that's maybe 3 years down the line. And so there are those resources available in the community, and so those are also going to be some I just wanted to call out too, that will help with locating places in the community, but also helping to pay security deposits. In some cases, this isn't going to be available for everybody necessarily, but it is available for eligible clients to help move back into the community. So just wanted to call that out.
So for the permanent supportive housing piece, VSH does provide, we provide our own case management on site at the property. And the focus of that is really around connection, engagement, and housing stabilization. So staff will work with residents around accessing mainstream community resources and services, engaging the residents in activities that promote a safe and consistent housing environment. The other thing that I really like is that we have property management on site, and that way supportive services and property management can collaborate to prevent lease violations and delinquency. It's just a really great relationship. They can help individuals resolve life issues, manage their mental health, ensure a strong sense of social connectedness within the building as well as with the community. And staff can also provide support around employment, education, vocational endeavors, as well as transition planning when our residents are ready to move out. Supportive services staff can assist with that.
I don't have a whole lot to add to what was already shared. One of the clear distinctions between the types of models that Julie and Anthony and Jayson work in is that the service-rich model of wrapping those support services around is typical in a permanent supportive housing or shelter condition, and it's sort of a somewhat specialized, excuse me, somewhat specialized area. And one of the challenges that I know they both can share that is true for us as well is that providing support services is incredibly cost intensive. And there are very limited resources out there to support support services beyond the models that Julie, Anthony, and Jayson just highlighted. So we are, as an organization, Piedmont Housing Alliance is continuing to try to find additional resources to broaden and deepen our reach with supportive services. But we look forward to, when we build our portion of affordable housing on the site, to actually having kind of a pilot relationship between Virginia Supportive Housing and Piedmont Housing Alliance to start to interlink some of those services to serve the residents more broadly.
Thank you all so much for that, your answers there. Before we move on to our final sort of Q&A and closing for today, I want to answer a few questions that came in from registrants related to the foundation's role in this project. And as I said before, this is one of the largest grant made in the foundation's 50 plus year history, which we're really quite excited by and proud of, primarily as it is an opportunity to reimagine creative solutions and reimagine, creative uses of the foundation's resources to solve some of our longer standing problems. But it is obviously a huge collaborative effort with our nonprofit partners. And so some folks have been curious about how we structured this grant. And so I'll just remind folks that this is a grant from our Community Endowment Fund, which goes to support all of our annual grant making, including enriching communities and other programs like strengthening systems and shaping futures. It is a recoverable grant, which is a new venture from the Community Endowment Fund for the foundation. And this is something that allows us to make a significant investment of capital resources with the option of those funds being returned to then create opportunities for future investments in local projects. There's been some questions about, like, are we looking for the next one of these? Are we looking for the next big thing? And the short answer to that is that the foundation is always listening. We are positioning ourselves, and I think that the beauty of this project really is that it demonstrates our commitment to partnership at every phase, right? So brainstorming and pie in the sky dreaming to boots on the ground, due diligence, and coming up with creative solutions, and then doing the work to develop the financial tools in order to support those endeavors. So we're always thinking critically about how to approach problems from a systemic standpoint. That said, we are continuing to monitor this project and to see how we might develop broader criteria and programming to support future projects. And so it's something that we are trying to figure out strategically and logistically how we might continue to do similar work. And so I would invite you all to stay tuned. Also want to name that part of the funding for this project came through generous support from donors and fund holders of the Community Foundation, and also represents the way that community foundation-driven resources and donor-driven resources can work together to make significant impact in the community. And so if people have, I know that there are some folks in the funding community and philanthropic community that are on the call today. We are happy to talk about how we structured the grant and some of the mechanics of that. But I will say that it really does start with longstanding relationships with the community partners in order to bring this kind of work to fruition in our region. And it would not have been, had it not been for those relationships, we would not have been able to move this work forward. And had it not been for the expertise, we would not have been able to conduct adequate due diligence within the time frame that was given to us to act on this. And so I'm really grateful for that. So that's my bit for now. I'm going to,
Can I interrupt for 1 second? Because I just want to share the reflective of that, which is to say, as you pointed out, that you would not have been able to do this without the community partners. And I want to flip that around and just say that this project would not have happened were it not for the Community Foundation's participation. The complexity and phasing of this project does not fit the traditional mold for traditional lenders. And none of us had the resources at hand to make this possible. So the unique partnership between all of us is pretty incredible, and really is a guiding light, I think, for this kind of work. So thank you.
Thanks, Sunshine. I appreciate that. We have a couple of quick, I think, questions in the Q&A, and then what we're going to do is end our time today with each of you sharing out a little bit about how our community can support your work in your respective phases of the project. So One question that we have is, does anyone have any clear statistics about the percentage or number of veterans who are homeless in our community? And maybe even giving a broad sort of scope about some of the demographics.
I can give that a shot. So I am proud to say that as of today, to our knowledge, we, I'll preface this by saying that part of the work that we do in our homeless system of care is we keep track of folks that we're aware of experiencing homelessness in the community as closely as we can, so that we can, encourage collaboration and coordination to help those folks move into housing. And so we keep what we call a by name list of everybody that we know to be experiencing homelessness in the community. And it's real time, or it's as real time as we can get. And as of today, there are 9 veterans who are experiencing homelessness in our community, which I think is a really significant accomplishment, frankly. I know that doesn't really work without context, but for many years, that number has been, 15 to 20, if not more. And so we are in what's called we are in a shift where we have made some significant progress towards working towards a functional end of veteran homelessness locally. We're not there quite yet. We still have 9 veterans who are experiencing homelessness, but it is a relatively small number for the size of our community. We are focusing in on that as much as we can. Some of those veterans are, as we get closer to reaching that functional end, are veterans that have a lot of barriers to getting back into housing. Eviction histories, credit histories, have been homeless for quite a long time, so don't have, lease history recent. And so all these things make it exceptionally difficult to helping those folks move back into housing. So that gives a little bit of picture of the demographics, but I don't have a lot of other statistics in terms of health conditions, but largely the veteran population who are experiencing homelessness deal with many of the same issues as folks generally, although with the caveat of people who have served, especially have seen duty, also have oftentimes a lot of barriers related to those experiences that they've had, PTSD, trauma. And so that's definitely common. Actually, Virginia Supportive Housing operates a program locally as well. That's a big support program for veterans in the community. So I don't know if Julie wants to chime in about anything related to the veterans and demographics, but that's a huge piece to the puzzle. So anyways, just quickly, it is an exciting time. We're making some important progress that we've frankly been stagnant on for the last number of years. We're in a unique moment right now with veteran homelessness. And so, yeah, I'm happy to talk more in depth about that too. If anyone wants to reach out to me, I'm happy to share more.
Wonderful, thank you. Can you, Jayson or Anthony, can you answer if or what the relationship with the Haven is to this development, if there is one?
Sure. So the Haven is our community's access point for homeless services, or the entry point, and will remain so for this project. People reach out to the Haven by walking into the Haven or by calling the intake line at the Haven when they need help figuring out housing, if they don't have housing, for prevention. So that's going to be the source for people to reach out to that will provide referrals for this project. They also are our local, what's called rapid rehousing provider. And so they'll be able to support eligible participants at Premier Circle with help with security deposits and rental assistance to move out into the community. And also they're the important prevention provider as well. So hopefully preventing people from ever needing to use places like Premier Circle. And so they're a crucial partner in our community and a crucial partner for this project. Even though they're not involved directly with operations or staffing on site, they are an integral part because they are the entry point for referrals, and hopefully also will help keep people from needing to use these services, but also will be able to help people in the back end. And also I have to call out, they've been a huge support this whole past year and are also helping in the transition into Premier Circle with preparing and delivering food for people. They've been helping, along with Salvation Army and other partners in the community, prepare and deliver upwards of 60, 70 meals every day for this whole past year. So a huge significant support in food preparation and delivery. And so that's also been an amazing role that they've played.
Great, thank you, Anthony. And so we only have a couple of minutes left, and I want to make sure that our participants know how they can get involved in this work. And so beyond supporting the work of the foundation, I'd like to hear some specifics from each of you. You each have 1 minute to share how best our community can support you. I want to make sure that we absolutely cover some of the staffing needs and food delivery services, just ways in which people can support through their time, their talents, and other resources. So I'm going to start with you, Sunshine.
I wasn't expecting you to start with me, Eboni, but okay. So I'm actually going to, from our perspective, and our perspective is a little bit longer term than the other folks on this call. So I will say that the support from our perspective ideally actually comes a little bit down the road. And there are really critical steps in the coming years around getting funding from local jurisdictions, from the county, from the city on other projects that are critical to enabling projects like this and facilitating the acquisition, getting matching dollars to facilitate the acquisition of the low-income housing tax credits and other financing. So from our perspective, that's the key driver. It's a little bit further down the road.
Great, Julie.
Yeah, so I guess our needs are largely financial, and that can be big or small, whether it's supporting some of the development, supporting furnishing one unit at the apartments, or helping an individual who's moved in get all the sheets and pots and pans and towels and things that they need, or even supporting the rent. We have individuals who have zero income, and there's still a $50 rent for those individuals. And so we have people that are actually sponsored by somebody who can pay that $50 for them every month.
Great, thank you.
And then also I was just gonna say our residents benefit greatly from any food donations. We go through those.
Wonderful. And so bringing it back to our current pressing and immediate needs, Jayson and Anthony, if you can talk about staffing needs and how volunteers can support. You mentioned food service delivery, and I think our community really wants to hear particularly how congregations can support you guys right now.
Sure, I'm happy to speak to that, and that has been a really difficult part of the pandemic, has been that limitation of volunteer interaction that we normally depend on so heavily. One way we've been trying to think creatively about this is, and we'd love to be able to involve volunteers as soon as possible, but normally when churches are acting as host sites, they do such an amazing job at just making the shelter space very welcoming. And we would love to have conversation with the church community and any volunteers about the ways that we can even do in the early stages of this project. And then food has certainly been a big way they've already contributed throughout this pandemic. The food conversation is going to be an evolving one. It's a little bit to be determined if what ask we may have around that. But I'm hoping to be able to offer an online meeting with whoever would like to get involved on this level. We really in the next 2 or 3 weeks even. We normally communicate with our host and partner congregations through a Google group. And if you're not a part of that, if you want to just reach out to me, or even if you're not a part of a congregation but want to learn about volunteer opportunities, we want that to be a really kind of vibrant, creative conversation. And it's obviously going to evolve and be dictated somewhat by the pandemic. And But yeah, totally open and eager to have that conversation.
Thank you
And
all.
I'm not sure, you had mentioned staffing as well.
I think, well, one, we're out of time.
Okay.
But I want to encourage those who are still hanging on there with us of a couple things. One, the recording of today's discussion will go out to all participants and will be available on the foundation's website. We will also be sharing with our communities the meeting that Jayson is referencing related to volunteer services. We will also ensure that each participant has direct contact information for each of our partner organizations for follow-up on how they can support those organizations. And I think that it goes without saying that operating a temporary shelter under evolving conditions requires a significant amount of resources
Yes,
and support.
yes, thank you.
And so money is never the wrong answer here. And so if you're looking for different ways to support these organizations, then obviously donations. And I think Jayson has also talked about some other creative ways that people can potentially get involved. I do want to just take a second to thank all of our partners today for being here with us, our foundation staff who supported the webinar, our donors and fundholder community who also support this project so generously, as well as the services of Martin Horn, who has been working behind the scenes to really ensure the safety of the rooms on the property so that folks can have a home and live with dignity on the property in the temporary shelter. So I thank all of you for being with us and supporting our community in this way. We will be in touch and look forward to connecting with you all soon.
Thank you.